I move to adopt the agenda as presented.
Second.
All those in favor? 7-0. First item is discuss gating criteria and load limit.
Okay, we have Lynette Reddington that's going to join us. And I'm hoping that I can get her. Can you hear us on that? Okay, let's see if I can get you here. Okay. Lynette, can you hear us okay still? Can you hear us okay, Lynette?
You're a little muffled, but I can hear you. How about me?
I can muffle. Let's see. Should be right there, so speakers. Okay. We're going to have Lynette Reddington. We're going to have all kinds of feedback items in life. Okay, we got Lynette Reddington here to kind of talk to us a little bit about happenings across the county.
Sure. I'm going to that's my time then, right?
Lynette, we're still having a little bit of an issue trying to get you projected sound-wise, so. In a month or two, folks, we won't have this problem. We're gonna have a good sound system. Are we okay?
These aren't, yeah.
All right, thanks. Me asking that we let him.
Sorry, Lynette.
All right, Lynette, can you hear us?
Yep, you're just echoey, but not sure if I am.
You sound good. I can be quiet.
Okay, I guess Lynette with GAD Christmas. I'll go to your place. I've asked Lynette to come and talk to us a little bit about the happenings going on in the county, and especially associated with the release today of the high school being identified as a cluster. And Lynette, if you want to kind of define what that means to be a cluster, according to what the KDHE has released, and also if you have any other additional insight for us, because I'm sure that you are having as much fun as we are with all of this stuff. Go ahead and share it with my board and them. I'm sure they'll have some questions too, but that would be great. Didn't hear what I said. Did you hear what I said at all, Lynette?
I just heard you now.
Oh, great. Okay. I asked Lynette to be here to share a little insight with what a cluster is defined as through the KDHE, and then just kind of what's going on countywide to kind of help inform our decision for tonight. So if you don't mind, that would be awesome.
Sure. Let's start with the cluster. So I have been working with folks. I talked with KDHE this morning when I saw that it noted a cluster for Newton High School, and we had not defined it as such here at the local level. So with speaking with them, they said, yes, the definition that I've been sharing with you all along in regards to what a cluster is still appropriate in the epidemiology world. That is, a cluster is two or more unrelated individuals who have received a positive, so a case, and they are we can pin it down to one source, one individual, okay? So that's the epidemiology definition. On the KDHE website, you will see that they note on their cluster definition that it is within a place, within a location. So public health determination within a location. So it surprised me, as it probably did you, that they noted that we had a cluster at Newton High School. They were only announcing clusters for any businesses, schools, long-term care, et cetera, when they have 5 or more active cases. So looking at that list, just to give you a little history, there's no Heston College, there's no Bethel College, because currently, though they are still considered an outbreak in our county, they do not have any, any active cases. We've just recovered the other person at this time. So they don't have 5 active cases, so they're not on that list. Yes, we have 5 active cases in Newton High School, and that is why it really triggered me to go, wait a minute, these aren't epidemiologically linked. And so that spurred me, as I talked with the individual, to look deeper to make sure they are not, or if they are. The concern is still out there. COVID is out there. COVID's in the schools. We know that. COVID is in our long-term care facilities. Also, unfortunately, it's in our businesses. It's in our households a lot. So just the overall picture I want you to know is that we are still working on those investigations to ensure if these are linked or not linked in regards to epidemiology, but on the state level, because it is one location, they are calling that a cluster and therefore are reporting it to the public as such under Newton High School. So I understand where they're coming from on that. They also understand where we're coming from, that I've been trying to educate everybody on the epidemiology definition. So we're just working together, and KDHE is very understanding and will work with us as well if we do not find that cases are linked to a particular source or 2 sources or however that works for these 5 cases. But we do that with every case. We're trying to find out where they have got the transmission from, where were they exposed to COVID. We do that for every case, and so our staff is working real hard to try to do that for all of our cases. So wanted to give you that for the overview for the cases there at Newton High School. Right now, our dashboard, if it hasn't been changed, will be getting changed for locally, our personal protective equipment during the kind of quieter time. We were able to get a lot of things available, as well as all of our long-term cares and our healthcare providers. So we have that in the green. We feel like we have a good grasp on PPE right now. Our testing, people who are symptomatic can definitely get tested in Harvey County. A lot more of our physicians are getting the antigen test. Again, we've talked about that before. That's a probable. If it's a positive and it's a negative, we don't count that as a case at all. But if it is a positive, we count that as a case in our numbers. Deaths right now, we unfortunately had 1 death last week and reported it, and though we haven't had one for a long time, so we have kept the death in the green area of our range. And then disease spread has been in red. It's going to continue to be in red. We doubled the number of cases in the entire county over the week. And it's causing us also to cause the tracking and tracing to go to red because we just don't have enough staff to get it all done. We are sending some to the state. We appreciate the state that they have some resources for us. So folks may have to wait just a little longer than the 8 hours that we were typically doing when we get the reports in. We get to people within the 8 hours. They might have to wait just a little bit longer. We are asking for 24 hours, but that's really long. We don't typically take that long to get to someone. Just know, again, people get your results before we at the health department do, because these antigen tests are like 15 minutes. And so you get your results, and we have to wait for it to get into the system. So we would like you to make sure, follow your provider's directions, get home, remain in quarantine isolation until we can get a hold of you at the health department. So appreciate that. And then our other large gating criteria is our regional hospitals. We have it noted as that, and know that all of our hospitals are now already at a capacity level. They are, the words I was given from Newton Medical Center, they're running at capacity. They're still able to help patients, but know that this is not far. We could start stressing the system even more, and that is what we were trying to reduce in regards to keeping the spread low. But in Harvey County, it is definitely growing. I know you can already look at your dashboards for the gating criteria, so I'm not going to go over any of those. I didn't pull any of those. I just want to make sure I gave you an update of what I know about the cluster, what I can tell you on our dashboard, and we are looking at the Health Department and the Harvey County COVID Task Force. We are looking at the possibility of moving to phase 3 in our reopening plan. That would be putting a limit of mass gatherings to 45. The other thing related to that is our long-term cares would be restricted to have visitors, but they have already done that on their own and voluntarily done that. So just know we are looking at that. That will be brought up at the commission meeting on Tuesday the 10th. So I'm going to leave it at that and have you ask questions if you have any.
Does anyone have any questions? You have to speak to me and I'll try to.
The antigen test that they're giving right now, is that like the real accurate one?
How good are the antigen tests that you are able to, that are being administered?
Do we have an accuracy?
Sure. The brand that we know is being used in Harvey County at this point in time, I don't have a percentage to tell you, but I can tell you from the individuals who have gotten an antigen test and then gone forward and gotten a PCR, we have had really 100% of them showing that if they were positive antigen, they were a positive PCR. And the PCR test is the gold standard that the state looks at for saying, yes, you're definitely COVID. We have had, I think it was one, so it wasn't 100%, sorry, 99%, that's pretty good. We've had one individual who had a positive PCR, a positive antigen, went to get their PCR and it was negative, so we could release that individual, we'll release all their individuals who are under quarantine. We are watching and monitoring that all the time because we don't want people to be in quarantine or isolation any longer than they have to. We've had one individual at this point. So the antigen test is pretty good. I will say also that the recommendation is for people to do it 5 to 7 days after they've had symptoms, because your viral load is larger and those antigen tests can detect it a little better. So 5 to 7 days is a good time to go and get the antigen test after your symptoms.
Can you ask her, you and I talked about if the 5, whether it's 1,000 people or 10,000 people or 5
When that statistic for a cluster is counted, is it just the number 5 period, no matter the population it is pulling from? Or is it a 5 out of so many in terms of being identified as a cluster? In other words,
Go ahead.
Is there a population that is compared to?
No, they are just looking strictly at active cases.
Within a facility?
Within that facility, right. Within that location.
I got a bunch of like stair-stepping questions, so this is going to probably be annoying, but I just want to go through these. I'm curious, and I know they're on the website, but I want some other people to be able to hear this. How many tests to date have we applied in Harvey County?
How many tests in Harvey County so far to date? Do you know?
I do know. I had a higher number I didn't write down, but this morning it was 10,169 tests. That includes PCR and antigen tests that have been done.
And we're
We
about,
had that 6,828 individuals at that time.
and we're about 99% accurate on both those tests.
Question is, and you say we're about 99% accurate on those tests.
Right, right. The antigen ones, that is us locally. We're finding that people who are going to get their PCR are coming up positive if they had the positive antigen. We're not saying that everybody who gets a positive antigen goes and gets a PCR. We encourage that because then we get a true picture that it is COVID But again, we are also doing the clinical picture of individuals when we talk about them and their symptoms and what's happening with them. They're really checking off a lot of boxes of what COVID symptoms are. So people go, well, I know this is COVID, so I don't need to go get a PCR. I go down and out, or I've got violent symptoms, and we monitor them that way. But we consider them a case, again, if it's a positive antigen.
Okay, even without the PCR. Got it. How many cases to date have we had here in Harvey County?
How many cases to date in Harvey County? Is that right on the dashboard? I can look at that, right?
If he updated it tonight, yes, and.
I said 11/3, I showed 7/12 on 11/3.
Let me just pop onto something really quick and I can find mine. I'm doing a screen sharing, okay? Here we go. All right, I have a total of 172 active cases right now. That's 172. We had 161 this morning, and we're up to 172. And just a moment, and I will give you 747 is where we are at for the number of total cases we've had in Harvey County.
Okay.
Is that what you were asking for,
Yep, yep.
Andy?
Yes.
And
Whoever was
then,
asking, okay.
how many of those have been hospitalized?
How many hospitalizations out of the 747 cases?
Well, right now we are tracking the active individuals in hospitals. They are not all locally, let's just tell you that. They're not all in Newton Medical Center. And, so yeah, we have 3 right now that are actively in a hospital.
No, 3 have been hospitalized out of the 172.
Right.
Right now.
Right. And do we know how many have been hospitalized out of the 747?
Do you know how many out of the 747 that have been hospitalized? Do you have that number?
I can check it kind of quickly. We'll see if I can pull that up for you. You want to know how many total have been in the hospital, right?
Yes, yes.
Okay. Yeah, I don't have my full database to be able to pull that up very quickly, but yeah, I don't even want to guesstimate for you, but it hasn't been more than 15 in all of our cases.
Okay.
Not more than 15.
How many of those 15 are, let's just say 18 and
Oh,
up?
you know, it's on our dashboard, I think. Is it not?
I don't see it on your,
Yeah, look on, hospitalized to date, 4.4%. This was when we had 712 cases. So 4.4%, it's the little slider button underneath the biweekly positives. If you hit the next arrow, little button on the bottom right, it's hospitalizations.
4.4%.
So 95.6 have not been. That one still is updated from current hospitalizations of 4, but we currently have only 3. Someone got out of the hospital. Yeah.
We've had, is it 9 as of today?
9 deaths as of today, accurate?
And yes, that includes the individual that passed away just.
And are any of these people, let's just say 18 or under?
Any of these individuals hospitalized or deceased, 18 years or under?
No. That I'm very sure of.
You're out of questions, Andy.
Yep.
I'm just glad I was able to translate it.
Thank you.
You're doing very well, Fred.
Anybody else?
I was just going to ask about, she mentioned going back to phase 3 and limiting to 45 people in a mass gathering. Is that talking about our facilities as well?
Does that phase 3, in terms of limiting the number to 45 at a gathering, would that include school settings?
No, we have not included schools on our reopening plan, so no.
Anybody else?
Just out of curiosity, I know that there's a little bit of, they're trying to work it out between what is technically a cluster, like she was mentioning at the beginning. If they find out that these cases are not linked at all, does that change anything for us, or will we still stick with the 5 KDHE cluster?
If you find that the 5 that are identified as a cluster are not connected in any way, will that designation change from a cluster, from the KDHE perspective?
Yes, we will. I got that clarified this morning with our PDHE epidemiologist. I said I don't have to wait for 28 days when we don't have any more cases at that particular location. And she said, no, you need to just inform us and we can get that designation taken off. As I said, we were surprised that it was on there.
I have a question about capacity at the hospital. So we currently have 3 hospitalized, but the medical center is saying they're at capacity. So what's that number?
The question about the capacity at Newton, and I will say that I had a call from Dr. Leeson this afternoon to pass that on to us, that they are full, and all of the other area hospitals are as well. So when you talk about only 3 active cases in the hospital, you know, why is it considered full? Do you have any idea? I mean, what other things are contributing to that status?
Yes, in regards to their COVID unit, they have individuals from other counties in the particular unit. In the rest of the hospital, obviously they're doing business as usual and trying to get folks out so they can have 3 beds for others, but they're certainly not rushing them. They are still serving patients.
Any others?
I just think they're confused with that.
Thank you, Lynette.
Lynette, thank you for your time. Everybody says thank you.
That's all you need.
I don't know. I think that's all we need. We can always call you later.
Yes, you can.
You're going to be in the office, I know. Thank you so much.
Yep.
Thank you so much.
All right, thank you.
Thank you. Thanks, Lynette.
Okay, so I asked Fred if he would kind of, and he's given us, I don't know, 3 or 4 different options over the last 48 hours, I think. So, does any of you have any specific questions about any of the options? Otherwise, I'll turn it over to him and kind of walk us through the recommendation.
So this is totally new as of.
The top one is totally new. I have not, that was after consulting with some administrative staff and a few others this evening.
So are these 2 separate options?
They are. The third, the other option that is that was given out to you all, which was the one that I put out, I think, yesterday, that isn't included. Based upon that cluster identification, I think that does change things. So that we'll go through the bottom one if you want to first.
That's okay, I just wanted to make sure.
Yeah.
I didn't know if they were separated or not.
Yeah, they are, where it says building modes and columns underneath that.
Okay.
Okay, so, our goal is to keep kids in buildings as much as possible. And we know that's the best for kids from not just an educational perspective. When we look at our criteria, and I give you all a copy of the criteria, what we initially set up, we've also been given a lot of feedback from parents, from staff, from patrons in the community about what we should be doing. So whatever decision you make tonight is going to be a wrong decision in the eyes of men, no matter what. No matter what. So, you know, it's too bad it's this way, it's just the way it is. My option to you that I would give based upon the change in status with that cluster designation is that we would look at keeping elementary schools up through grade 4 in 100% in-person attendance. Because, once again, I think that hybrid model is pretty difficult for kids. I think it was pretty difficult for staff as well. All right? And I still am concerned about how many kids on those 3 days were at home alone that were lower elementary kids or even upper elementary for that matter. That's a huge concern to me. We talked about that a lot in this room, and that still is a concern. We would still have the remote day on November the 18th, and if we extended this past Thanksgiving, we would look at also keeping that one on December the 2nd. One of the other things that has been asked for from staff and from parents is that we have consistency in whatever we do. We thought when we adopted that mode of yellow to go into next week that that's where we were going to be there, but we didn't know that we would jump as many cases as we have. And I do think that we need to pay attention to that data. I really, really do. Okay? So what I would suggest, whatever option we pick, we go to Thanksgiving, period, no matter what happens in terms of data. And that's to be able to provide that consistency for families. They need to be able to plan that out as far as we can allow that in terms of data. I really, really think that. So as I said before, the first option, keep elementary up through grade 4 at 100% in-person attendance. 5 through 8, move to or stay in hybrid. They're already in hybrid in grade 7 and 8. 9, 12, switch to remote based upon that cluster designation. Okay? Right now, that mode would stay in effect. And we can talk about what would bump us out of that. If we were to go in green for 2 weeks in a row, for example, or say red for 2 weeks in a row, that really can't happen between now and Thanksgiving based upon how we would make this decision. More than likely. Okay? But we can have a fail-safe in there if things get great, because we have a fail-safe. And I was going to make a got a comment, but I'm not going to do the yellow and orange criteria would remain in effect for the activities, so those numbers would continue to be monitored and reported, and we would just make that decision administratively, just based upon what the gating record is for Monday if we have activities. And we're going to start having junior high activities pretty soon, so that's the reason they would stay in that situation. Buildings would only be closed, and they wouldn't be closed. We would go fully remote based upon staffing issues, which we continue to have. Okay. Right now, when you look at staffing issues, we currently have 62 staff on quarantine. That's up from 55 this past Friday. That's up from 55 this past Friday. Okay. Right now, student-wise, just for grants, we've got 208. Now that's up from 118 this past Friday, and it's Wednesday. So, it's just the dominoes are falling. The dominoes are falling. And then we would revisit this on the 23rd if you chose to not go till Christmas, okay, and then make that decision for after Thanksgiving until Christmas. Once again, kind of heck or high water type of a thing, just because we want that consistency with families.
So do we already have a meeting scheduled on the 23rd?
23rd is a regular meeting schedule. It's a regular meeting schedule. The other option is to really follow our criteria. And follow our orange until Thanksgiving, once again, no matter what, if there's a change in data. Okay, no matter what. And that would mean, if you remember, in orange, that would mean that our pre-K through 6 is hybrid, our 7 and 12 is remote. All right? We evaluate again, as I said, on the 23rd for the final 3 weeks. I would not suggest we stay in this until Christmas. I would suggest we only do this until Thanksgiving. Extracurricular activities, however, would follow as it would in that other option. If we had a change in status, if it went to yellow, we could increase the activity. Our parents could show up. If they're in yellow, there is no attendance outside. Right? Buildings, once again, only go to remote due to staffing issues with cases and quarantines. Now, got some pros and cons with this one. The pros really is the staffing of the buildings actually becomes less difficult this way for us. Because if we're in full remote in grades 7 through 12, we're not gonna have to worry as much if we have other high school staff quarantined, because they'll be teaching remote anyway, okay? It also really does allow us, because of the number of quarantines that we're having throughout our district in these other buildings, the ability to staff those using existing staff from those other buildings, because they're in that hybrid mode. And I'll tell you, we're just like it was this past Saturday, we're struggling with staffing buildings, and that's not going to get better. That's not going to get better. I mean, I can't stress that enough. I want to give Jane and Sheila kudos for all the work they did last week with all that stuff, but we're still struggling with staffing our buildings, okay? It would provide that certainty for everybody, and we are then following our original criteria, okay? No one can say we're not following that criteria. The cons associated with that, I think, I don't care what anybody says, those educational opportunities just aren't as good for the kids when they're not in person, period. And I'll harp on this until I die, that custodial care for K through 6 is an issue. It just really is, because I still wonder, and I think, Andy, I think it was you that told me, I wonder how many kindergarten kids were at home alone because they couldn't take advantage of the wire, didn't understand that was an option for them. And I worry about that tremendously. So those are the two options that I would recommend. That third option of going hybrid at the secondary level, just based upon what's going on, I'm not that keen on right now.
On which one?
That was the third one, the original one that I shot to you guys yesterday that I felt really, really good about. Until this morning. It's not even on that sheet, it's in Board Docs, yeah.
Red.
Yeah, you know, I was gonna run all that off for you, but I'm cheap, I just wanted to give you the two options that you
Come
want.
on, do I get to bring you a ream of paper like I do my kids?
You know, if you wanna do that, we'll take it, you gotta give us a nickel per color copy, too.
Okay.
I'm pretty cheap,
A
so.
couple of quick questions before I forget. I was multitasking over here. Opportunity Academy, whatever we choose off of this, are still full on-site.
Absolutely.
Correct? Okay. Another question we're getting is, what are other schools in the county doing?
They're making some of the same tough decisions you are. I know Halstead is considering what it is they're going to do. I don't know when that board meeting is going to be. I think it might be tomorrow night. I think Heston was moving at least to yellow. I know I got from Sedgwick that they were also going to move to a different mode as well because of what's going on with them. Everybody's making a change right now, based upon the county numbers.
If this morning, if we weren't categorized as a cluster, what was your thought? And I know that's what if, but like when that's saying, if we find out, and I'm not saying I'm going to make a decision based on if, but is the cluster the piece that kind of saying like to the next step?
It is part of that, for sure, because just from a community perception perspective, we get that label that we don't care about our people. And that's not accurate. And I can't reinforce that enough, that is not at all accurate. We're trying to find that balance between, we're serving our kids and caring for the adults that work for them. That's why, like I said, we're going to make half our people really happy and half our people really mad. It's a matter of which group do we want to make angry. And I don't want to make anybody angry, as do none of you. We just got to make a hard decision again for the second time in 4 days.
And remind me, about 80 students took advantage of the, oh gosh, what's the name of the program?
The Winning Edge.
Winning Edge, yeah,
That's not
about
kidding. 90? Out of how many ballpark students total?
Well, we actually had 140 say they're interested, but when it came down to it, it actually showed up at about 9.
And how many students do we have in those age groups? And I know that you have to split it in half almost for hybrid days.
How many students total do we have in that age group,
Yeah.
8 through 6? We would have 12 to 1,500. Right? We're about 3,400, well, 3,200 is the district. So we probably have closer to maybe 1,100 when you pull out some of the pre-K numbers and stuff.
Okay.
I think Joni sent me an email with that.
I think you're right, I can't remember you asking.
So if we say 550-ish on a hybrid day, because that'd be half your students.
Yeah.
We had about 80 to 90 out of 500 and some take advantage of that program, which some families obviously don't need to utilize that, and that's fantastic if they don't. But we also know there's families who do, but aren't able to utilize that even if they need it.
Yes.
And I wish it was as easy as just looking online at the numbers and saying, this is our call. When you do look at the numbers, but I want people to understand that we're still considering, like you're saying, students home alone, very young students home alone, safety issues in their homes or wherever they might be during the day. So it's not as easy as just looking at the numbers and pulling the trigger to make the best decision. It's very complex.
So, I guess in my mind, I see it's a thin out model, but I love that we're trying everything we can to keep up with fourth grade. I'm looking at the 259, I know it's a different monster, right? But I look at the conversations they have and how desperately they're wanting to get their kids back. And the teachers and the problems they're having and the stuff they're seeing with mental health and a lot of other stuff, it's a big deal, right? So thank you, Fred, for trying to fight to keep our kids in school to the best of your ability. And I'm really excited about keeping those kids from K to 4 in the building. That makes it a lot easier for me, even though it's not easy to make a decision tonight.
Well, just for some more numbers for you right now, and this was when I pulled the information earlier, we've got 19 staff cases up to this point, and we have 22 student cases.
And that's cumulative, that is not active right now.
That is just total. That is just total. But you do have to remember, most of our cases have been within the last 3 weeks. I mean, so it's not like that's been spread out since the start of school. So
Sure.
we really have to, I guess we have some of that up there. And David, if you can scroll that down a little bit, you can see some of that. I think I put some of that below. That might even be a little bit off. Because when I run those, I put that down, 22 students and 19 staff. And I know we might even have a few more tonight, who knows? I mean, we get those calls all the time, so. And just the number of, when I ran those quarantine numbers for staff and students earlier, I mean, some of that has changed, like the student number, it's up to 218 now.
And the staff or the students are mostly high school, or is it, middle school and high school?
No, that is not really the case. When we look at the totals, we have one elementary school actually has 25 quarantine students. Okay? High school has our largest number by far. There's 71 at the high school quarantine. At the middle school, we combine the middle school, we've got 59 students. All right, then the rest are elementary. We've got 2 elementaries, 3 elementaries that have over 10 kids that are, and that too is difficult for staff, frankly, because they're doing 2 different things. They're teaching the kids in the classroom and they're teaching the kids online. And really, in that hybrid model, that would be helpful for them because they would at least have all those kids 2 days of the week, 3 days of the week in one mode. You know, so I mean, there's like I said, no good answer with any of this stuff.
A couple of questions that are just kind of rolling in from other people or coming to my mind. Are we allowing remote students to still come back at this time, or have we stopped that?
It really is dependent upon the building and if they can handle those remote students coming back in. In some cases, they can't because of the numbers that they have in classes. Okay, or from a scheduling perspective, they're unable to do that.
And I thought I had a question for Lynette, but I think I can look it up here online. If they are discussing moving to phase 3. In phase 3, hold on, trying to read on the fly here. And I know I'll get misquoted or have this taken out of context, no doubt. I'm not advocating that this should happen. I'm just throwing this out. We're not looking at shutting down anything else community-wise. Restaurants, extra recreational things, whatever that may be. That's not on the line. We're only looking at closing our schools.
We're not closing any
Not
schools.
closing, but we're looking at taking children out of classrooms, but we're not looking at, and this is a whole can of worms, which I'm glad I don't have to make this decision, but it's just kind of rolling around in my mind today. Adults are still free to do whatever they please.
can't speak to that at all. We don't have the pay grade to make that decision. That's going to be a county commissioner. And in their meeting next week, they're going to struggle with exactly these same decisions, I'm sure. I mean, it's just is what it is.
It is, it's terrible, absolutely
Yeah, it
terrible.
is.
It's terrible when we think about little kids who can't take care of themselves and putting them at home alone.
I have a question, Fred. What is your proposed start date for either of these modes?
Monday.
Monday, okay.
Yeah, we've got to give parents time to plan. We just couldn't do it.
Okay, I was thinking longer than that, because we already have approved something.
We have it through the 13th, but I just, once again, people get frustrated and upset because we change so often. And I understand that, I get that, but if we didn't change, we would also be accused of, wanting to sacrifice, the safety of everyone. So I just think that the data is there for a reason, and we do have to pay attention to that, but also, we haven't had, like at that elementary level, a lot of our issues in terms of cases, in quarantines have been, some staffing issues and stuff like that. So I mean, but not all of them. There's some instances, and understand this too. When you look at that hybrid model in grades 5 through, let's say 5 through 8, for example, or 5 and 6, the reason I really strongly suggest that is because we cannot at Santa Fe socially distance. It's not possible. Okay? It just isn't, And another option, another option we could throw out to you too, is we just shut down school for 2 weeks, period.
Right.
We just shut it down, but we understand if we do that, we've got to make up that time. So that means we're taking stuff off of not Thanksgiving, Christmas break or spring break or going into June. And I'll bet you money, marbles or chalk, folks won't want to do that either.
Right, well, and that's the dilemma that I've worked out in my brain, right? It's like, do we go red because we don't do something now in our 8 and 4, 4th grade? Little guys been up at home for 2 weeks, and how do we fight for that to not let that happen? And Fred, we get those text messages, those numbers we're seeing up there, they've been accumulating and going faster, and that's nerve-wracking. And I can imagine what you guys are feeling because you're in the trenches. And so when I get them, I'm thinking, oh my gosh, I'm like, imagine you guys moving staff around and trying to figure out how to cover this, and it's a very complicated situation. The other point is, and I don't know, this is probably not the right time, but where do we look at hope to the other side of this, right? How do we plant those seeds for families and for people and for myself, to be quite frank with you, with, one of my kiddos at home because they were in close contact, But I see what this looks like. I'm living in it on both sides here. And so I appreciate you guys and what you're doing. I understand what the families are going through at home. We're living it too, to a certain extent. What's right here? I don't think there is a right or wrong answer. There's the next best step forward, right? So anyways, with that being said, I'd like to start making decisions here. Also talk about what hope looks like and start manifesting the next step. What does our threat look like? How do we isolate that threat? Is it a threat that we should be making these big moves? Looking at what's happening to these people after they get sick and they come back, and what does that look like? I mean, the reality of the fear has shaken us up so much, I feel like we're just hacking away at a tree, right? And we're not looking at the other side to see how far we gotta go. And my hands are tired. And I can only imagine what you guys feel like. And this is through all our staff. I mean, principals, teachers, paras, janitors, cafeteria, I mean, it's just craziness. Anyways, that's my 2 cents, but we gotta make a decision to move.
So the two options are essentially, option 1, K4 stays on site 100% unless their building has staffing issues. 5-8 is hybrid, 9-12 is remote. Okay, and this would be through the Thanksgiving holiday break.
Through November
And then we
24th.
reevaluate and possibly extend or make changes as needed. And then the other option is to go orange according to our laid out criteria. Okay, I just wanted clarification. So, I lean towards the first option you presented, to keep our K4 in buildings. The elementary teachers that have reached out to me, and there's been a handful, have specifically said how much of a struggle going hybrid was for their little kids. And I mean, I'm a mom of a first grader, and, you know, I can understand that struggle, and then they have 20 of them to help along. And I just think that if at all possible, they need to be in the classroom, that's the best way for them to learn. Either way, our high school is going to be remote if we were Orange, or if we make this decision on our own. It kind of breaks my heart for the high schoolers, because I know there are lots of them who are also struggling, and our staff is doing the best they can to meet their needs, but I think it's just falling short for a lot of them. I don't have a solution for that other than let's just all try to get through this. But my choice would be the first option, the one that's changed from our normal criteria.
So we're going to, we call it the modified order?
Modified,
Yeah, give it a name. Give it
modified orange?
a- Modified orange.
Okay, this isn't where you're pulling the orange?
I'm too tired to read. Really?
I'm gonna be honest, I'm still kind of looking things over, and I'm not trying to take the easy way out, but I'm listening and reading, so can I pass for a minute?
And I like the, what you call it?
Modified orange.
Yeah, I think the modified orange, like Jen said, you know, we've heard from a lot of parents and teachers that the little kids need to be in the building as much as possible, and that the hybrid is really, really tough for them. But yeah, it's tough because not everyone's gonna be happy, and there's no way to make everybody happy in this situation. And the high schoolers, it's tough. It's tough for them to be in remote. In my work outside of here, we are seeing mental health and things increasing, and the kids are really struggling at that age level. We're hearing it's not fun anymore. So I'm really worried about those high school kids. Hopefully this will be shorter than longer. But we kind of need to be mindful of those high school kids too, because they're struggling mentally with this whole situation. But I'm leaning towards that first option. That's why.
So you can hear me. I definitely like the modified orange here versus what you emailed us a couple days ago. That was a little bit too much for me. I just worry that if we go with this modified orange approach, that we'll be making a more severe decision in a couple of weeks. Kind of like what you were saying, Andy, a little bit ago. How do we know when's the right time to really do our part as an organization to kind of help our community right now? Before I got in here, I saw a Facebook post from the new medical center that we're the 7th highest county in the state, and we all really need to do our part right this second to buckle down and to try to keep the numbers a little bit lower. So I personally lean more towards the third option, sticking with our criteria, sticking with a regular orange. I think that's better than going into remote in a couple of weeks. I know you guys are concerned about the littles and not being in school, but I think 2 days is better than no days. And we're getting a lot of text messages from Fred about cases and quarantine, so I think we really need to try to buckle down to control some of that. So I would lean towards more the third option.
I like the idea of keeping K-4 in the building, and that is not, it's not any personal preference of mine, that's based off of a lot of feedback that we've gotten from our staff, and from parents, and so I would, if we were wanting to stick closer to orange, I guess we could ask the question, if 7 and 8 could also go remote. That way the only change we would really be making was that K through 4 part of it. But, you know, we just know a lot more now than we did 2 months ago when we started this thing. There hasn't been transmission within the school. So, I understand what you're saying about wanting to slow the spread of the community, but as far as we know, the school's existence hasn't been part of this spread as a community. There's been no transmission still to this point.
I think there has been one or two.
Okay.
Yeah, but you know, I mean, I'm not gonna say with 100% certainty, those numbers are starting to run to be.
Right, well, I mean, at this point, we've got so many cases, you've got that many close contacts, you test them all, one of them's gonna pop hot, and who knows where they got it from. So, but overwhelmingly, when you're looking at the, what's it, 172 cases we have right now, that's not because school's going on, that's because things are happening in the community. Again, based off of the feedback that I've received from, you know, our teachers that care about the safety of the kids and education. I mean, at a certain point, we have to decide how important is education, and we know it's not going as well as it was before. You know, when we had all our kids in our building, and life was normal. So if education is important, we got to prioritize it and make it work as well as it can. That's me is having kids in buildings as much as possible. So I'm in favor of the modified orange that you guys spoke about. If we're going to do anything else, maybe to look at closer to the original orange, I would say, should we talk about 7 and 8 being remote as well? That's the only thing.
Yeah, I support that. So K through 4 or
K through 4 on-site, 5 and 6 hybrid, 7 through 8 remote, or 7 through 12, sorry, remote. Listen, basically, if you look at orange, it would be exactly how it's written there, except 3K through 4 would be on-site.
Okay, so I have a question about the 7th and 8th grade.
Yeah.
The high school, when they're in remote, they have a bell schedule that they follow. Does the middle school, the 7th and 8th, have that same? Yes.
Well, and that's one of the things that they want to make sure that they do. They have a bell schedule, and they're going to require those kids to get on at that time.
And the 7th and 8th grade building is doing that?
That's what they are going to do.
They're going to do it
Yes.
on Monday as well?
Yes, that's
Okay.
my understanding,
Okay.
because they're just like everybody else, trying to figure out the best way. You know, we try to provide that asynchronous opportunity, because we know some families, they can't be there to make sure those kids are doing it at that time. That actually has been a stumbling block in some respects, because then, you know, they haven't had that requirement. There's been only the one meaningful contact by a teacher every day that's been the requirement. So their goal is to require those kids to get on every hour. The thing that you're going to hear from on the other side of that is, because of some of those parents that can't be there, you'll hear about attendance issues. You know what I mean?
Right,
But
but
that's okay.
a couple weeks ago, our high school principal said that the remote kids, the straight remote kids, 30% are not doing well.
Right.
So I want to make sure that that doesn't happen when the rest of us are in remote. Because that's a hard amount.
It's huge.
So that's my concern with that. And that's why I think being in the building as much as possible is, you know, something we have to keep at the forefront. Of course, you know, looking at all the numbers and stuff, but we can't have 30% not doing well in the district, that's one building.
I think I've come up with more questions than answers listening to you guys. Luke knocked one of them off my list, so I can cross that off.
Can we get her on mute, like they have with the biggest?
No, because I think we should make motion in the minutes.
We need a motion?
No, I bit my tongue earlier today because Mr. Ortiz started off with a bunch of questions and I thought, look at me, I'm not doing that yet. And here we go. Okay, so,
That's right.
and didn't work. Okay. When, I can hear you laughing under that mask. Are parents able, if they've chosen hybrid, are they able to move to remote?
Parents don't choose hybrid.
If they're in hybrid, are they able to, flexible, yes.
I don't know if anybody has stopped them from doing that, but I don't know if anybody's asked to do that.
I think there's been a handful of pieces, and I wouldn't have a number to that, but just in visiting with staff, and why the reasons would be on that, I don't have that.
If there was a family that really desperately said, flexible, do not, I don't feel comfortable, I want to go full remote.
I think one that is coming to my mind is more on the concerns of the health side of it.
Right.
That's one that I can recall that I had a conversation with a staff member in the last week that
Sure.
commented.
But if they did have those concerns, that would be an option for them.
They really would need to contact their building principal because we have to be careful about the capacity on that side too. That's the problem going back into the buildings. You know, that K through 6, for example, we've got a certain number of remote teachers. We could take more in that remote, but they'd have to understand when they made that switch, it's a different teacher, they may be at a different place. You know, so doing it at this point would be not impossible. It's better to go that way than just to go from remote in person, just based upon how those issues have been at this point.
We touched on this a minute ago about how our remote students are doing. A couple of questions. I believe the last time you talked to us about this, our 30%, that was a truancy rate. Am I remembering that correctly? 30% of remote were not engaged?
They were not engaged. That doesn't mean it's truancy. That, you know, that means just they weren't engaged. Okay, they may be checking in, but they weren't doing academic work.
Okay. Are we still seeing that same number now, or has that changed?
I haven't heard a decrease in that number, but I'm going to be honest, I haven't asked that specific question either since that time.
Do you have any idea how our remote students are doing on an academic level?
Well, they're not being as successful as they would be necessarily in person. And that too is a little bit of a, you've got to be a little mindful of how you look at that, because we've had a large percentage of kids in the regular classroom environment that have been unsuccessful for years too. We just, you know, we just have the ability to get our hands on those kids a little bit easier because they were in the building. You know, so I don't know that percentage either that have been unsuccessful out here. I've been here.
When you were discussing the Chisholm Bell schedule, you have a kid at Chisholm? Two. Okay, so we've got kids at Chisholm. Is this a change from what they're currently doing on their hybrid days?
I don't know if it's an actual change, but I know that's something that talking with those administrators, they want to require their kids to do that because they are struggling with those kids that are hybrid or remote.
So they would have to
I
check
don't know,
in,
hybrid, yes.
they have to check in every hour.
That's what they want to require those kids to do, yes.
But for attendance, if they make it to one, they're technically,
Technically, they met their requirement according to what the guidelines are for the assurances for us to be able to count the kids. Technically, yes.
And that bell schedule, like when we're at hybrid, so the day, like my student is in high school, so that is a change for those 3 days that they're not in the building. They had not had a bell schedule before, so that's new starting Monday.
It is, yes.
But I think that's a good change,
Very good change.
from what I'm hearing.
Oh, I think it's a great change.
gosh. Yeah, so, I know, right?
3 minutes.
It's
You, but it wasn't working.
You think this is fun to live with me. No, I wish it was an easy decision, but it's really not. Taking everything into consideration, I would be leaning more towards the modified orange. And I know some people will say, well, we don't know that we have kids home alone. We don't know these things. And sure, you're not going to have those exact numbers. We've never had exact numbers that we can pin that down. And then we'll hear, well, if these board members were in our classrooms, if they understood, I'm not in a classroom, so I don't see the full gamut every day, 100%. I'll never get to see that. but I get a little taste when I listen to Google Meets all day with 3 kids from 3 buildings. You hear things. You hear things you don't want to hear. You hear kids say things and their tone of voice that you don't want to hear. You have teachers reach out to you that say, even if they were very nervous about coming into a building at first, about what COVID was going to look like, they're in, they have their kids, and they say, please just give me my kids. It's heartbreaking to be on a computer with my littles who, number 1, can't read, number 2, can't navigate a platform. And then to know my kids are not in the safest place right now. It's heartbreaking. And yes, we're hearing a lot of voices from both sides, but for me personally as well, I try to think about this group and these kids, and even some adults who don't have a voice. They don't have anybody emailing for them. They don't have anybody texting a board member saying, we're not okay, our kids are not safe at home. That's not happening. So just because we don't hear about it, specific numbers doesn't mean it's not happening. So I would lean more towards keeping our littles in the buildings as much as we can. And I know that hybrid's not fun for others, remote's not fun. But when we really think from the education standpoint, putting kids at home who can't even read. I mean, they can't read, and a lot of them have great support at home. A lot of them don't. And some of these kids that are struggling at home, it's not because their parents don't care or their parents don't want them to succeed, not at all. But sometimes that's just not an option, and that doesn't, I'm not insinuating that our schools or our teachers are babysitters for our kids, not at all. But I personally really have a hard time thinking of our youngest kids at home and not in safe places.
So, and I agree, I think the modified warning is the first option to get, so like that. People will learn. I do worry about the fewer kids we have true remote, that's what I thought of. 30% that we talked about before. So, there's no easy answer. But I think, as you said, every district's going to be trying to modify right now. So I think the modified warning is where I'd like to go.
Would you mind if I make a motion, or?
Can I say something real quick? Would you guys consider, like how Lou suggested, keeping 7 and 8 in remote, like in normal orange, and then the little kids in person, and then 5, 6 hybrid?
As I said, the fewer remote onlys that we have,
Well, and I think with the 7th and 8th grade in particular, I've heard from a lot of parents that the summit program and this hybrid remote stuff is not working well. So I think that they need to be in the building those 2 days, and then that way they can get some assistance from teachers. So I'm not in favor of 7th and 8th.
All right, so real quick, I'm gonna make a motion here, and I appreciate listening to everybody, and this is the thing, I think we're gonna have anxiety, so I wanna make a motion, and I know we have great communications, so because we see this here, they're gonna start freaking out, because there's a change being made, they don't have this information, so guys, stay tuned, you'll get the information, you'll understand exactly what this looks like, depending on what vote happens here. But I wanna go ahead and move to approve the modified orange mode of learning beginning November 9th through Thanksgiving holiday.
Second.
Wait a second, any further discussion? All those in favor? Opposed? Is there anything else, Rick?
I hope not.
Okay, we're done. Thank you for putting this together, and thank you for flowing with this. I know it's been kind of a very fluid situation all week long, and we're only in.
It's only Wednesday.
Thank you very much. All right, I'll entertain a motion to adjourn.
To adjourn.
Second.